In this video, shared by Dr. Hassan Barani from Erbil, Iraq, we will discuss the surgical technique known as the inverted flap for treating macular holes. This is a case of a patient with stage 4 macular hole in which the surgeon opted for the inverted flap technique. After performing an extended core vitrectomy, brilliant blue is used as a dye for the internal limiting membrane, allowing its proper identification for peeling. After aspirating the excess brilliant blue with the vitrector, we can identify the presence of negative staining of the epiretinal membrane adjacent to the macular hole, and the surgeon uses a tonneau polisher to open the internal limiting membrane. We then observe the execution of the inverted flap technique by the surgeon with an ILM retinal forceps. In this technique, the internal limiting membrane is not completely removed from the retina but is driven to the edges of the macular hole. Peeling is performed circumferentially at a distance of about 2 disc diameters around the hole. Besides eliminating the anteroposterior and tangential traction of the epiretinal membranes and the internal limiting membrane, there is stimulation of cell proliferation and migration of glial cells to the macular hole, promoting its closure and consequently improving visual acuity. Therefore, this technique is quite effective for large macular holes, greater than 550 micrometers. After completing the peeling, the surgeon trims the excess internal limiting membrane with the vitrector. Fluid air exchange is performed, and gas is injected at the end of the surgery.